Well, in today's health, we want to talk about osteoporosis. It's a disease that's very common, yet nearly 80% of older Americans who suffer broken bones are not tested or treated for it. And 1 out of 2 women and about 1 out of 4 men over the age of 50 will break a bone due to osteoporosis. That's according to Bone Health and Osteoporosis Foundation. So what can you do about it? Let's ask the expert. Joining me now is Dr. Sonal Haerter with Dignity Health Medical Group. All right, explain for us exactly what is osteoporosis.
So osteoporosis is basically weakening of your bones because of bone loss. And there's another term called osteopenia, which is a lesser degree, but they both indicate bone loss in your body. And this is serious because bone loss can result in spontaneous fractures or fractures from small falls or even movements like bending or coughing vigorously.
Wow.
And so this is kind of life-threatening in some cases. People can die from these bad fractures.
Yeah, well, and when you look at, the statistics, we're talking 1 out of every 2.
Absolutely.
I mean, it almost sounds like it's inevitable.
And in biological females, it's actually very common after menopause. That is one of the biggest risk factors. So after 50, most people actually have more bone loss than bone production in our bodies. We all have that. And there are certain risk factors that actually make it even worse. So menopause is one of them. People who are on chronic steroids, people who have lower body mass index, or people who have struggled from eating disorders or bariatric surgeries, or something that is actually not letting you absorb calcium and vitamin D. So like celiac disease or inflammatory bowel disease. These are some of the risk factors for osteoporosis.
Now, we talked about, how common it is in women, 1 out of 2, but why is it not as common in men?
So men tend to have lesser bone loss compared to women. However, there are certain risk factors you have to look for. So for example, men over the age of 70, or if they have certain risk factors like excessive use of alcohol, tobacco use, smoking is a risk factor, or use of corticosteroids, or loss of male hormone due to testicular surgery, or any treatments that are blocking androgen, production can actually put them at risk for osteoporosis.
Wow. Okay, so let's talk about treatment. That's always so important.
Correct.
What can we do about it?
So going back to prevention, exercise matters. Weight training, strength training, just staying active is very important. Eating nutrition that's well-rounded, so having calcium, vitamin D, getting your vitamin D levels checked, those things are very important.
Right.
Now, treatment-wise, we have medications called bisphosphonate, Prolia, parathyroid hormone analogs. There are some treatments, oral medications that we use for osteoporosis.
Okay.
These medications help produce newer bone and also slow down the bone loss.
Okay, is there a test that we can get to see if we have osteoporosis and that we need, like medication?
Yes, so it's called DEXA scan or bone density scan.
Okay.
It's like an X-ray, and they really can actually give you not a prediction, but numbers on how much bone loss there is and the range and severity of it. And based on those numbers, actually, we determine if somebody needs to be only on vitamin D and calcium versus medications.
Yeah, versus the prescribed meds.
Correct,
yeah.
exactly.
So how would you know if you need just the supplements over the counter?
Correct. And so it depends on who your patient is, how severe is the bone loss, and what is the cause of osteoporosis. In postmenopause, for example, sometimes we use hormones along with calcium and vitamin D and bone-producing medications. Right? And certain patients, if it is celiac disease, and it's important to look at their GI symptoms as well and take care of that. But in general, based on how severe the bone loss is, we use certain medications to treat that.
Because the consequences
are hip fracture, lower spine fracture. This can result in death. This can result in actually debilitating and getting into rehab for several weeks to months, surgeries, and this can be life-threatening. That is what people forget. It's not just a fracture.
Right. Oh, it's so scary that, and it's so common too.
And Tran, one more thing, there are no symptoms. So the only symptoms are when you get pain from the fracture.
Wow.
Sometimes we see loss of height and change in the posture, so stooping. Those are some of the signs, but otherwise it's a silent disease.
All right. Thank you so much, Sonal. Now it's